I did this one time and I wasn't recording, so I hope I get it this time. Go again. Start it. All right. Abnormal psychology, specifically anxiety, depressive disorders, bipolar disorder, and many eating disorders. Abnormal psychology is very important to know about because the majority of the people in this world probably know at least one person who's even either going through it. Maybe you don't know that they're going through it, but they're still around you. Whether it's someone you work with, someone in your family, maybe a future kid that you might have a mental disorder. It's just very important to know these things and know what to do, what treatment to get, and everything like that. Abnormal psychology is a branch of psychology dedicated to the study, classification, and treatment of irregular patterns of thoughts, emotion, and behavior. Common disorders can be depression, anxiety, or bipolar disorder, eating disorders. There's PTSD. There's so much out there that people go through, and there's a chart down here in the corner that shows you the percentages of the disorders in the population, and understanding it is just key because while also knowing the causes and the risk, we can also know the treatment, the recovery, just to help the people around us get better. What are these disorders? Depression is a type of mood disorders. It has to do with feelings of sadness, loss of interest, many different types of depressive disorder. There's major depressive disorder, there's seasonal, there's clinical, there's postpartum, there's so much out there. People with anxiety experience intense, excessive, and persistent worry and fear on a daily basis. They worry about the what if, the unknown. They worry about so much that's going on in their life and so much that hasn't even happened yet, but they can't control it. It can even lead to anxiety and panic attacks. And there's different types of anxiety disorders as well. Bipolar disorder, which is formerly known as manic depression, is a condition that causes extreme mood swings. You could be super, super high, super, super low, and sometimes it can be episodes of it. You can go days and weeks of being super high and then super low. It's constant mood swings. Eating disorders involve a disorder relationship with food in the body or the body weight, body shape. It can just cause excessive behavior like starvation, starving yourself, or eating way too much, like binge eating. But depression is 21.4% of the population. So this is around one in five adults. And if you know five people, then likely at least one of those people deals with some type of depressive disorder or hasn't been diagnosed yet, but just deals with some type of depression as well. Some of the common disorders are major depressive disorder, persistent depressive disorder, seasonal affective disorder, and there's so much more. It can involve feelings of sadness, like I said, emptiness, hopelessness, excessive fatigue, loss of interest in hobbies, something you used to really like doing, you might not want to do it anymore. You might just be too tired, too sad to even like um take take part in those activities anymore just because the mental health is just so draining and it weighs down on you so much. It can affect your memory, it can affect your physical aches and pain, it can affect your appetite, it can affect your personality as well. It's not just a mental disorder, like it can also hurt you physically, it can cause physical problems as well. Anxiety is 31% of the population, so roughly one in three adults, and I'm pretty sure most people know three people. And if one of them deal with anxiety, that means a third of this world is dealing with some type of anxiety, either disorder or they just deal with it on a daily basis. Types of these disorders can be panic disorder, social anxiety disorder, generalized anxiety disorder. There's so much out there, and it can involve feelings of intense, excessive, and persistent worry and fear. Like I said, worrying about the what if, worrying about tomorrow, the future, something that hasn't even arrived yet. You can even be feeling nervous when talking to someone. You can be really weak, tired, be sweating, trembling, just from feeling this anxiety, just from feeling this worry. And again, it can cause anxiety and panic attacks, which are very, very intense. Bipolar disorder, which is a little less common, around 4.4% of the population experience this, is because it's a type of depression, but it's extreme, extreme emotional highs and emotional lows. The emotional highs are known as mania or hypermania, and the lows are known as depression. It can affect your sleep, it can affect your energy, your interest, and it can be long episodes, like I said, of super highs and super lows. Eating disorders are around 8% of the population, and 8% of the population experience um, one of these types of disorders, and there's so much out there. There's anorexia, bulimia, binge eating disorder. It can do with not eating enough and starving yourself, or eating way too much. It can have to do with your body image, your body weight, how you see your body, how you think others see your body. It's basically a disorder relationship between food and the body, weight, and so on. Restrictive eating, avoiding certain foods, stuff like that. Causes and factors of these disorders. Biologically, it could be from inherited genes. It could be passed down to you by your parents if they have a mental disorder. It can be neurotransmitter imbalances. You could have chemical imbalances in your brain that lead to your mental disorder. It can be hormonal changes. It could be passed down to even your children if you have a mental disorder. It can even be certain brain structure differences that you have, and temperament differences, and just literally be your makeup in the way that you are made. Psychological factors could be childhood trauma, could be low self-esteem, stress for a long period of time. If you go through a lot of stress for a long period of time, you may develop something like anxiety, or even unhealthy thinking patterns can lead to mood disorders as well. Even if you have difficulty regulating emotions, even if you're a perfectionist, if you want to do everything well, maybe the failure will cause you to have a mental health disorder because you want to be so perfect. More causes can be environmental factors. They could be abuse, neglect. You could have a hard time financially, in relationship. You can be going through a divorce, or even your parents could be going through a divorce as well. It can even be academic stress, social media comparison, which is a huge thing nowadays because social media is everywhere. Cultural expectations, trying to live up to what people expect you to be. Lifestyle factors even be alcohol and drug overuse and misuse, poor sleeping habits, social isolation, stuff like that. That can lead to mental health disorders as well. The overuse of anything can lead to mental health disorders because it can just cause an unstable daily structure and can affect your body and your mind in those ways. Treatment for these disorders, it kind of varies based on the person and the disorder and what they're going through. Basically, there's each person is basically different. What may work for one person may not work for another, and sometimes it may take a while to find the right one. It could be a little discouraging at first if the first thing doesn't work, but there's something out there for everyone. There's so much research out there, and there's so many doctors out there caring for these people with these mental health disorders, but it's not a one size fit all thing. It's very circumstantial based on the person and their specific needs. Treatments for depression and bipolar disorder, it could be cognitive behavioral therapy or psychoeducation therapy, and this targets the negative thinking patterns. There's antidepressants, there's all types of medication, behavioral activation, which increases positive activities and engagement. There's just so much out there for depression and bipolar disorder. Treatments for anxiety, again, CBT, there's exposure therapy, relaxation techniques, there's medication specific for anxiety as well. In eating disorders, there's CBT specifically for eating disorders. There's nutritional counseling, body image therapy. There's all types of therapy and medication, and there's all types of doctors out there literally wanting to help these people with these mental health disorders. But the chances are someone you know is going through at least one of these disorders, maybe even multiple. It's very important to know about these disorders, have the knowledge of them, and just acknowledge the people who are going through it. Even if you are not going through it, no one close to you is going through it, it's still a very real thing and it matters. We all struggle differently. We all have something that we struggle with. People who go through these illnesses and disorders, they need help. They can't get through it alone. They may not even need medication. They may not need therapy. Maybe they just need a community or people around them. Maybe you can be the cause um, in the change in someone's life that can help them get through it and help them through their disorder. So thank you so much. This is my presentation. Stop share and stop recording.